Welcome to the Dirty Side of Leadership podcast with Ron and Kristin, where leadership meets entertainment. This podcast features stories with names and certain aspects that have been changed to keep submissions private. Enjoy the show.
Welcome back to the Dirty Side of Leadership podcast, where leadership meets entertainment. I'm Kristin Sokoloff, and I'm joined by my co-host, Ronnie Ward. How's it going today, Ron?
It's going great, Kristin. As you know, I'm always excited to do the podcast with you, and we've got a humdinger today, folks, so stay with us.
Oh my gosh, we sure do. So today's episode is unique, and we are certainly looking at the dirty side of leadership. So I love when our title, we try to do this in almost every episode, but this one is extra dirty. So we're going to see what happens when accountability disappears. And we talk a lot about accountability on our podcast, Ron, rightfully so. Today, we're breaking down what I would call a shocking story that has been circulating in the news, where prosecutors say a Haitian national in the state of Florida exploited a federal healthcare program that was meant to help vulnerable Americans and ended up stealing more than $58 million from taxpayers.
Wow. It's hard for me to fathom, that much money.
Yeah.
Without, of course, the red flag. So anyway, there's a lot of leadership lessons here, but this kind of story should infuriate Americans. Fake patients, fraudulent prescriptions for HIV meds, kickbacks at a nonprofit clinic gaming the 340B drug pricing program. The proceeds, you ask? A Bentley, Flying Spur, multiple Mercedes, and a $2.5 million waterfront mansion. At least they had good taste, Kristin.
Yeah, they got the waterfront there. Oh, yeah, so bad. So many issues here, so many red flags here.
No kidding.
And, let's just keep in mind that this is a program that was created to help vulnerable patients, and it was turned into a criminal gold mine, allegedly.
Yeah, allegedly. Gene Jethro Alexander and his co-conspirators allegedly recruited fake patients off the street, paid them kickbacks, had nurse practitioners write bogus prescriptions, and then billed Medicare, Medicaid, and private insurance companies through the 340B discount system. In some cases, the drugs were just destroyed. The treatment was never the point. It was the reimbursement. That's what they were going for. And Kristin, in my federal career, we had some of these cases. They're so hard to prosecute. For example, when we had a case involving the elderly, number one, they wouldn't remember a lot of the tests that were run, or it's easy from a subjective standpoint to go, yeah, we needed to run these additional tests on someone, and it's hard to say that that's absolutely out of bounds. So these cases are very difficult, and it looks like allegedly that they might have this person's number and the co-conspirators.
Oh my goodness. Yeah, no, that is wild. And generally, I saw this in banking also. The elderly people, that is a haven for fraud because of what you're just talking about. They're vulnerable. Their memory isn't always sharp, right? So it's just, we see a lot of fraudulent claims coming around, and it can be family members, it can be caretakers, it can be a complete stranger that befriends the elderly person. But, what we're seeing, we mentioned this number earlier, over 58 million in false claims. I mean, think about that. Your tax dollars funding luxury cars, this waterfront mansion, while real patients and honest providers get squeezed. I mean, this is theft, plain and simple.
For our listeners' sake, the 340B program was supposed to stretch resources for safety net providers serving low-income Americans. This thing gets worse and worse.
Oh, yeah.
I was reading that weak oversight, opaque contract pharmacies, and massive financial spreads turned into a target for fraudsters. They could see that there were weaknesses, and boy, did they take advantage of it. Representative Diana Harshberger, a pharmacist herself, told Fox News it became massive and poorly supervised.
It's like, how does this happen? We continue to see this waste, fraud, and abuse. And this is like, when this was brought to my attention, It was the first time I was hearing about it. I know it's been in the mainstream media, but there should be more outrage. I'm so glad we're covering this today, Ron.
Yeah, no kidding.
When I was doing research on this, I saw that Representative Morgan Griffith said that this is another example of the program straying far from the original intent. We see that all the time. And Senator Bill Cassidy, I would say, put it perfectly that every stolen dollar is a dollar taken from families who need it most. This program should help patients, not enrich criminals, which is exactly what it's been doing.
Yeah, no kidding. Now, from a leadership perspective, like anything else, this did not happen overnight.
Yeah.
Patterns were ignored, huge prescription volumes, concentrated high-cost meds, questionable patients, good systems. Catch this early. Obviously, there was a failure in all the systems that led up to this. And then it ballooned because accountability was missing.
Yeah, exactly. And you talk a lot about the systems in place and how throughout your entire leadership career, that was something, I would say that's a theme that we bring up, and that you were looking to put these systems in place to identify gaps and potential oversight. How you were working for the government, how does this continue to happen with government agencies?
Well, to use one of your banking terms, we call it checks and balances, right? You've got to have oversight. You got to have accountability. And I did have an incident that I told on a very small scale where we found a weakness in our accountability, our checks and balances. And of course, it created a situation, which is actually in my book, where I terminated an employee. But it was nothing like this. But it caused us to revisit and tighten up in some areas that we needed to do. Yeah. And all companies need to self-police. They need to have audits. They need to make sure that their systems, their backups, and all of that are in place. So as a result of all this, the Trump administration and DOJ have been cracking down on healthcare fraud. And this case shows why it matters. Alexandra got just under 10 years and owes $14.3 million in restitution. Good luck on collecting that.
Yeah. Can you help explain what is restitution? Right?
Absolutely. That was something that I was very involved with. U.S. probation, we would help judges determine the amount of restitution. That's the amount that's owed. The problem with that is a lot of times they take in other factors like the ability to repay and those kind of things. And usually it definitely affects fines, because you can get a fine in addition to restitution. A restitution is what's owed back to the victims. So in this case, compared to the loss, I don't even know that $14.3 million pays it all, but that's what the court ruled, and that's how it goes.
Yeah.
As a Haitian national, though, he'll be turned back over to ICE for deportation after prison. Senator Marsha Blackburn is right. If you come to America to steal from taxpayers, you should be sent home. I get that, but good luck on that $14.3 million.
Yeah, I know. And that's where I was watching, because, I love true crime. I know you do too. I was watching something the other day, and it was like this guy, someone's in jail for multiple murders. I don't know if you remember the redhead murders, but they were able to find out who the murderer was, and then restitution. There was a restitution dollar figure that came out, and I was like, oh, what? I didn't make sense to me, but I guess for victims, it helps, I guess, with the processing, or to show that something actually did take place, that they were a victim of XYZ. And even though they're not going to see that fiscal dollar amount coming their way, it's just, how would you explain that better than I am right now?
Yeah.
Maybe the emotional aspect.
When someone is under supervision, that's part of, and by the way, this is Corrections Week, so happy Corrections Week to
awesome.
all of my colleagues. When you are dealing with fines, restitution, all of these factors, one of the things that probation and parole officers, pretrial officers, they help the courts in determining what is the realistic amount this person could pay. Now, most people have an attorney who can also argue that at sentencing, like, we can't pay this amount. So it becomes somewhat convoluted. It looks good on paper that you are ordered to pay this amount of money in restitution, this amount of fines. Yeah. But collecting that becomes extremely difficult. And there was case after case where I saw that it was just impossible. So this is probably a loss to the state of Florida and the federal government.
Yeah, and I was thinking, I'm like visualizing, okay, he has a waterfront mansion, and I think earlier we said it was like worth like 2.3 or something like that. But so they're going to sell that off, right? Or the bank will sell it off. And then I don't know how that, maybe some of the proceeds, depending on what's owed to the bank, could go towards this number, maybe that Bentley or the Mercedes, right? Like those could be sold off, but that's just barely scraping the surface of that 14.3. So it really isn't. They'll go through the house, right, and do. I don't know quite how that works, but they
it's
go
a
in and
property
take
seizure. Absolutely.
Property seizure.
If you can connect any, it's kind of the fruits of the crime. If you can connect it to the crime itself, then the government can seize it. The issue here is now properties are going to usually bring some money, but a used Bentley and different things, there's so much depreciation that it still doesn't pay nearly the amount that would be owed here. But it is something, as you said. So, through that process, they will auction that off. And usually the money either goes into a police department or an investigative agency. It's not like we have this link that says return to taxpayers. That it doesn't work that way. Because I remember early in my career, I'm like, who gets this money, when we're paying? And it usually will go in for other investigations, things like that.
Very interesting. I mean, no American should have to fund somebody else's luxury lifestyle through government programs. Congress now has a clear opportunity. The gap has been identified. So here's that clear opportunity to strengthen oversight, close those loopholes, demand real transparency on how the savings are used, and add meaningful accountability, probably my favorite word in the English dictionary, without abandoning the goal of helping legitimate patients. So this is a big job, but absolutely necessary.
Yeah, and this doesn't just apply to the medical field. It could apply to any business, but everyone should have risk-based audits, better patient verification, or other verifications, depending on what your business is. You definitely want whistleblower protections. There has to be a way for people to be truthful. And, the government has things set up like plea agreements and things, but a lot of times internally, people do not feel protected under the whistleblower law. And consequences across the whole chain. There should always be a list of consequences, and sometimes you have to set an example to, incorporate that. So we can support safety net care and still insist that taxpayer dollars actually reach the people who need them, not fraud networks.
Yeah, absolutely. I mean, this isn't about being anti-compassionate, right? Like that's not what the objective is here. It's about refusing to let good intentions become an excuse for bad stewardship. And I'm curious about, in your experience, Ron, because you led at a very high level within the government, and what I saw a lot, and I shouldn't say a lot because I actually think banking as a whole, like I worked at 3 different banks and they did a great job navigating all of this, gap analysis and everything. So I will say I saw some great things. But what I continue to see and get feedback from listeners in is where one person does something. So like we have this one incident here, right? And there's a lot of waste, fraud, and abuse out there. But instead of going and looking at it and closing the loopholes like we're talking about, sometimes there's an overcorrection and they're like, we're not going to do the program anymore. We'll cut the program. Or it's like, it's the easy road. Can you talk to me about when you've seen this and why this seems to be a knee-jerk reaction by a lot of leaders?
Yeah, and in common terms, that's a knee-jerk response. Basically, there's so many variables that come into play, but you have to save face, and you're embarrassed, so you eliminate a program to show we took action. But in all honesty, this 340B seems to be a very effective program, or at least has the potential to be. So many times you want to protect the mission, and so yes, you're right. And leaders should not knee-jerk. You need to go in here and learn from this, set up those parameters, and make this program run and make it work for the people who really need it. And I am frustrated at all of this stuff because, we bring the human touch to leadership here.
Yeah.
But it's time that, especially in the medical field, we have to start taking oversight very seriously and make sure that every penny is spent where it's supposed to be spent. So this is a call upon all the, from businesses to the medical industry. It's time for some accountability and oversight.
Yeah, I agree. And this reminds me of, all of the good work that Nick Shirley's been doing, where you just can't unsee it with uncovering the fraudulent daycares, adult and child daycares.
Yeah.
And now, lo and behold, they're everywhere, all over the United States. This, we're talking about a story out of Florida with a Haitian national, but can you even imagine the scale of the abuse that's happening within this program? This cannot be, like, just mathematically, statistically, all of that. This cannot be the only case out there. There has to be more abuse of this program.
Yeah, and again, from a leadership perspective, we can see that. I think it was interesting that obviously these co-conspirators saw that there was an opening. So a lot of it is the image. If you start off and they can see that you have got these parameters in place, these checks and balances we talked about, they're going to back off. So they look for openings, they look for weaknesses. And if an employee or someone even in a business, if they see that they've got complete autonomy, and we're all about autonomy, but you have to protect financial interest in particular. So you have to have backups. I watch these spy movies and I think, how did someone sneak top secret information out of a government facility? But even in tight restrictions, it's been done. We know that. But from a leadership perspective, we got to start off a program, and as soon as someone walks through the door, they need to go, ooh, security's tight, or the policies and procedures are enforced. Someone is watching me. So it starts from the bottom when someone just sees a program all the way up to the top of not having the proper restrictions in place and the proper security measures. Right.
And I want to address the 900-pound elephant in the room, or however heavy. It's quite heavy. But the fact this was not an American screwing over fellow Americans. This was a Haitian national who came in and took advantage of American taxpayers. And again, I mentioned Nick Shirley earlier, and the fraud that he uncovered, again, that those were not born in the United States Americans, right? And so that has an element of frustration that's like the next level. And I just wonder, Ron, is there a handbook out there? Come to the United States. There are so many loopholes. There honestly, there has to be some type of, I joke with the handbook, but there has to be something out there saying Americans are stupid. There's loopholes everywhere. Go take advantage of them. Have you heard of this? I mean, I've been seeing it for decades. I knew Slavic people coming over in the 90s, and they would tell me so many loopholes, and like, it's just like a known thing.
Kristin,
have you heard?
I worked in and around the prison system, and it was stunning. Number one, the ingenuity of things that they could invent, but also the communication chains were amazing. So there's no question that information gets back. Of course it does. And probably specific information. Here's what you do when you come over.
Yeah.
But Kristin, I think it's very sad that this is a political issue. This should not be a political issue, but unfortunately we're so polarized that we turn everything into that. This is about people, and again, they want to go back and say, it's about the border. It's really not. It's about people coming illegally and committing crimes and then getting away with it, and then everyone else paying because some people really want to be nice. And there may be some pure motives there, but no one would let people into their home without locking doors, those kind of things. So I would love to see us come to a reality check instead of a political platform.
Absolutely.
But I also see unicorns and rainbows. So,
I mean, common sense should be for everybody, but we're seeing that's not the case. And unfortunately, anytime it involves someone that's come over to our country, they're automatically defended by one party, no matter the fraud, the waste, fraud, and abuse that's taken place. And so, I'm glad you brought that up, because this should infuriate both sides of the aisle.
It should.
And maybe it does, Ron. Maybe it does, but it's all that facade.
Right.
That is put on, like, where how they're not, it's like they have this unwritten, or who knows, maybe it's written, where you do not ever publicly talk about how this disgusts you, but they have to be talking about this in private.
Yeah. So, Kristin, as far as our listeners, this was a little bit off the beaten path, but we always handle kind of controversial issues. But we would love to hear from you. What do you think? Is this kind of episode you enjoy? It's a little bit of a news report tied in with some leadership lessons. It was definitely enlightening for me, but it is hard not to get a little some personal feelings when you're finding out about, fraud and the fact that it wasn't even a citizen who committed this fraud. Those things should fire anyone up. But we would love to hear from you. And also, Kristin, I get the analytics, and we have grown. This podcast has grown, and we are so grateful to all of you that you've either told someone about it, you've liked, shared, rated the podcast. There's so many things that's happened, and we're pretty grateful. So, number one, we want to hear from you. Do you like this type of content?
Yeah.
Number two, thank you for helping get the word out on this podcast.
Yeah, no, we're extremely thankful. And, I just, as you were talking, Ron, I had this idea. You know how you do Ron's rants?
Mm-hmm.
It would be so fun to, at least for me, to take some of those rants and build a full podcast episode out of them. Because can you talk to us a little bit about what you're going over in those?
Yeah, well, people just submit things to me when they're frustrated. It's so funny you said that, Kristin. I got 2 this morning.
Sweet.
And
I love this.
I'm going to call one because it's about, and I know you've heard this, everyone listening's heard this. You've got leaders who say, my door's always open, and you've got psychological safety. They love to use those words. And she said, every time someone gives feedback, they get defensive and angry, and it does not serve you well. So it's one thing to say you have psychological safety, but it's another thing to actually have it and adhere to that. So it's that, and then, of course, it's another complete breakdown in communication. Yeah. So, I'm going to probably do 2 new ones today. And the other one that I got was about someone who gets a lot of people viewing their stories on Instagram, but never like anything. Oh. And it was basically 1 or 2 people, they felt they were really just kind of stalkers and, was jealous.
It's a whole thing.
It's a whole thing.
I hear about this often. Yeah, that'll be really interesting. I think
that's a good idea, though. Let's think about that. Yeah,
we can dive into the psychology behind it, and especially with that last one. Yeah, that's huge. But so I've been enjoying seeing Ron's rants, and then I literally was like, oh my gosh, we should build that out into an episode. And really dive into it, because if one person's experiencing it, there's no way they're alone, right? It's like scale that, and we know at least a percentage of listeners are dealing with the exact same thing quietly on their own. And it's going to be beautiful. We have to do that.
Yeah. Kristin, this was fun.
Yes, it definitely was. And I just love how, when we find something like this and we're able to scale it and break it down and really understand, and I love your background because it really helps understand why these things happen, how these gaps exist, right? But then going into the ways to bridge these failures. Just so much here. So thank you so much for everyone listening. Yeah. And remember, everything we talk about can be applied in your personal and your business life. So you just need to listen and then relate back to yourself. Very important. And, this has been a great episode. Thank you for tuning in to the dirty side of leadership. We hope this story fires you up, because that means you have a pulse. Share it out. We need more voices demanding real accountability, so programs serve Americans, not criminals living large on our dime.
That's right. Well said. All right, everybody. Be the leader you're meant to be.
We'll see you next week.
The Dirty Side of Leadership podcast is brought to you by Forward Operations. If you'd like to book Ron or Kristin for speaking events, training, or executive coaching, visit forwardoperations.com. Be the leader you're meant to be.